much, Dr. Panagis, for that introduction. And Dr. Yabo, please, can you introduce yourself?
Yes, yes. My name is Yabo Basanjo. I'm an epidemiologist. I am on the faculty of William and Mary, which is a university here in Virginia, in the US. So I teach public health courses. At the beginning of the COVID epidemic, I was involved in some how we densify our campus, and that led me to being on the public health advisory team of the university president, which has been on now since the summer of 2020, when we were planning if we were going to open in the fall and how we do that. So we meet twice a week and look at our data for our campus. That work on the public health advisory team led me to be involved in vaccine hesitancy information. That came from the fact that we found out when the vaccine came out and we were asking for staff to go get the vaccine, that we had more hesitancy among the lower level staff, which were janitors, housekeeping, dining workers, who are predominantly African American on my campus. So I volunteered to do an outreach to them. I felt that as a middle-aged Black woman, and most of them are middle-aged Black women, or for the most part, that there could be a common ground. And so I had some interesting conversations, just like Dr. Sikipa was mentioning, about where the vaccine hesitancy comes from. And just also to add, I'm vaccinated myself.
Thank you so much for that introduction. So I'll start off with you, Dr. Panagis, and my head is bursting with so many questions for you, but let me start by asking about this whole, in the US, which is where I am also, the vaccination of healthcare providers has been prioritized. We were put in the first group when the vaccine rollout strategy was put in place, and not just in the US, I know, all over the world. What do you think about that whole strategy? Has it been successful? And what have been the challenges of this effort?
Yeah, no, and thank you, Kachi. It's a great question. And I think it was always the right response to making sure that we stay safe, caring for patients with COVID-19, especially because it's an airborne virus, and especially because a lot of the equipment that we need to manage patients with COVID-19, from N95s to PAPRs, it's a lot of equipment to keep us safe as we manipulate sometimes the airways, like putting in breathing tubes and so forth. So your nurses, to your physicians, to your physical therapists, we wanted to make sure that we stay safe, one, and two, not bring the virus back home. I mean, I can't tell you, I still struggle. I still see a therapist with some levels of acute anxiety about my days working with patients with COVID because of this eerie feeling of, did I bring the virus home, right? Am I going to infect my kids and my wife and so forth? So the vaccine helping us there as your last line of defense against COVID, I thought was the appropriate response to making sure we stay alive, right? Because when we talk about healthcare resources, human resources are number one, right? You can have all the breathing machines in the world. If you don't have humans to administer it, you're not going to do at all well. There was another side to the coin though here in the United States, where one population that was massively, disproportionately impacted were nursing home residents, right? Residents that, because of their chronic ailments, resided kind of in skilled nursing facilities and were seen every day by just healthcare professionals. Well, if those healthcare professionals brought in COVID from the community, asymptomatically spreading it, those individuals with chronic ailments are going to get sick. And we saw that coming into our hospitals, were elderly individuals who got COVID from healthcare professionals to begin with, right? Again, unintentionally. So the efforts to get us vaccinated, I strongly believe was the right decision, because we're a very critical resource to making sure the rest of the population stays safe if you get ill. How those campaigns have been going, they've been going successfully. I mean, many hospitals have rates anywhere from 95% to almost 100% of getting their healthcare professionals fully vaccinated. Granted, there's always going to be a few here and there that won't get the vaccine for various reasons, and we just have to have those conversations with them. But this gives us the assurance that I'm not, even if I catch COVID, I should still be alive. And if I catch COVID, I can at least recognize that I have symptoms if it develops, and I can isolate myself more effectively from my family and not spread it to them. So by far, I think it was the right move to make as we went down the chain of who else should be getting the vaccine.
Thank you so much, Dr. Panagis. And Dr. Iyabo, as you were introducing and giving that introduction about the, I'll say the really great work that you have done at Mary at your university in Virginia here. I'm a fellow Virginian, so really nice to see that. And your conversations with the middle-aged, especially people of color. We know that there are many rumors that were really placed in people's minds, and that was why they had doubts regarding the vaccine. What are some of the challenges surrounding this mis or disinformation, and how have you and others addressed them, or how did you address them when you were talking with that group, and how have you continued to address them in your work?
I believe that when Dr. Sekipa, and then one of the questions that is on the chat came up, it brought to mind some things. One of the areas we haven't mentioned is one of the avenues for the disinformation is the internet. It's a big avenue for it. And I think there is what I called the Black social media, and it is global. And there is, at the beginning of the pandemic, I don't know if I was the only one that actually have this linked, but there were videos circulating on the internet that really permeated what I would call Black social media, which was videos talking about the infertility issues, video talking about Bill Gates, videos talking about Bill Gates is trying to put chips in people, videos talking about, and some of them had actually quite erudite, articulate professionals who were actually already most of them have been removed from their professions because of other kind of things they had done. There was some against Fauci. These things permeated, and the regular world of good information did not follow through, right? So there is some information network out there that goes around the world. The internet is part of it, and then people talk about it to each other. So I've heard issues like the movie Legend, that Will Smith was the main actor. Apparently, one of the premise for the movie was that it went back, it came from the future to say a vaccine that was being used caused problems in the future for humanity. People quote that movie, and it's not one or two people that have quoted it. So there is this kind of permission. There's the issue of Nicki Minaj saying that our cousin's friend, right? This idea that Black entertainers, there's a Black, and it's global, because I heard the same thing from the janitors at my university that I was hearing from relatives in Nigeria, right? The same kind of disinformation. And there's been no follow back from accurate, we don't have videos that are permeating the internet saying, no, the vaccine is okay. Things like Dr. Anyatu said about infertility, experiences like that, a video saying, this is my problem, this is what I had with it, but see what happened to me. We don't have any counter to those disinformation.
Thank you so much. I think that is really, a very good perspective and observation, and I think a way forward for all of us in this whole fight, or in this whole advocacy to people to get vaccinated. Dr. Panagis, maybe just building on Dr. Iyabo's feedback, and with the patients that you saw. I know you said you're a pulmonologist, but when you had people that came into your care that had COVID, were there concerns raised about, either female or male sterility, female infertility or male sterility? And I mean, how were you able to address it, or what do you want to share to this crowd, to the audience?
Yeah, no. So I'm gonna make a point of general emphasis that the fact that we're realizing we're battling two pandemics, one from Mother Nature, a viral one, and one created by our own selves, right? This notion of misinformation that is plaguing us and mitigating literally the antidote to getting out of this pandemic really should put healthcare, a big lens on us and say, how did we get here, right? How did we get to the point where we can't be seen as a public trust to the communities that we serve? I mean, I'm hoping out of this moment today, a movement occurs where healthcare, hospitals, academic centers, et cetera, really need to feel present in the community. We can't just react whenever there's a public health crisis. We gotta be there constantly. We have to make sure people see us as part of their lives and not just when we need them. So I'm hoping that begins to shift, because that's the best way, in my opinion, to combat the misinformation that is gonna occur again in the next health crisis. If we are seen as a public trust, misinformation won't even have an ability to have a voice. Now, in regards to fertility conversations, these happen all the time, right? And this is a plague of misinformation. The studies have come out repeatedly. 3 great studies published in high-tier journals that went through vigorous peer review put a nail in it, saying, no, fertility issues aren't there. But with that said, when you talk to patients or other human beings, right, it's like music, right? There's 1,000 notes out there, right? Or because someone brought up Nicki Minaj, but the best song only uses a few of them and organizes them together, and it launches it, and people love it. So when I talk to patients or people that are hesitant, I ask them, what is your concern? Once I hear that, then I begin to tailor the science towards what means the world to them, right? Because I could easily spend hours talking about COVID to them. That's not going to win them over. Just like using all the musical notes that exist, you'll just get a cacophony. So I organize it to them. What's their concern? Let's meet where I can help mitigate that concern. That's how I approach it constantly. There's data that supports that. But again, same data, I could say there's like a 1 in a billion chance a person will still hear, so there's still a chance, and not really recognize those odds are incredibly rare. So you try to meet them where they're at. The other part that we participate in with community engagement, we sometimes get their community leaders, whether it's a priest, imam, a rabbi, to come and help us with that messaging, because he or she can actually take the messaging and interpret it in a way that's massively meaningful to that community. They'll quote scriptures out of the Quran or out of the Bible or out of the Torah, and suddenly our science supplemented with their culture, that's the impact. So Kechi, there's 2 things to impact. One is I'm hoping we plant the seeds to make sure we are never seen as an entity that doesn't have the trust of the community. We have to work actively, constantly being present in the community. And then in regards to your question, it is just meeting them where they're at and aligning key points of COVID messaging that are going to be impactful for them. It takes time, though. This isn't something you can rush. You got to be courteous and respectful with each human being.
Thank you so much. So I think I made the call and I said, everyone have your coffee and tea, and they've done that, and there are loads of questions. I'm going to try to respond to a few, and my apologies if we don't, because of time, we don't get to all of them. We will definitely have your information, and we will be sending feedback from the panelists. So I'll start off with the first one. I think this is for you, Dr. Iyabo. It says here, another reason for hesitancy has been the fact that some people have been convinced that traditional plants will do the job. There's been a flurry of such claims, the most prominent being by